My name is Toby Kollmann. I'm a professor of microbiology and immunology and pediatric infectious disease at Dalhousie University in Halifax. The funding from River Phillip is going to support a project called Empowering the Disempowered. Adverse pregnancy outcome is probably the biggest health problem of humanity and has been for a long time. The current approach to pregnancy care is that once there is a problem, the medical system takes you in and manages the problem as good as they can, which is not very good because we understand so little about how and what and when and where. The goal is to change current pregnancy care that's focused on managing adverse pregnancy outcomes into one that prevents adverse pregnancy outcomes, and do this in a manner that allows this all to be done remotely. Every pregnant person who gets an early antenatal care visit gets offered the opportunity to take one of these wearable watches and one of these breathable devices home, and then keeps the device on until the next antenatal care visit and does the daily measurement. And then that data gets transmitted and is analyzed automatically. And the physician gets a signal about every patient, can monitor this and say this is the wrong trajectory, risk trajectory, and that can be transmitted back to the community, back to the pregnant person herself. And with this, everything that needs to be done to allow the physician to focus on those that need interventions, and everything that needs to be done to keep women who don't need an intervention to stay at home in the family, in the community. What we're trying to do is trying to prevent the problem from even occurring to begin with. So by allowing us to identify this person is on a trajectory that is at increased risk, for example, for preterm birth, we can then use interventions that are available to target that specific trajectory of that specific pregnant person and redirect it towards a healthy term birth. By us empowering the system and empowering the women, we're reducing healthcare costs because we're focusing on prevention, and we're empowering the pregnant person to remain in the community, giving sovereignty of birth and pregnancy back to the woman, her family, and the community. Without River Phillip, we couldn't do this at all. Without your passion to invest in us doing this and delivering this care, this opportunity to Atlantic Canada, this would not happen. And this longest standing, deadliest pandemic of human history would just continue unabated. So the impact this is going to have is going to be tremendous. And so thank you in the name of all the people who will benefit from that.